Make sure that everything is developing appropriately as well. Now, at that age, you can better judge blood pressure, you can judge vision, hearing. You want to make sure that if they're athletes, you assess their heart. You want to make sure that an athlete, when they go into the playing field, that they don't have a heart condition that can cause them to have trouble while participating in their sport.
Dr. Esparza is just great. He's wonderful. He makes the kids feel at ease when they're in there. He doesn't talk to them like children. He talks to them on an intelligent level, answers their questions in an intelligent manner. He's very honest with them, and I appreciate that. Doesn't lead them off in the wrong direction and tells them exactly what they need to do to have a healthy lifestyle.
Whenever you go into his office, they kind of make you feel like you're going into your other house. Thanks to the yearly checkups of Dr. Esparza, I feel better and I look better, thanks to him.
What it means for Forest Park to be a part of the Austin community. We're just really excited to be here. We feel very honored that the surgeons have asked us to be a part of the Austin community. It's a great opportunity for the surgeons, it's a great opportunity for the patients in the North Austin medical community. What makes Forest Park different from other hospitals in the Austin area and even throughout the U.S. is that we're a truly physician-owned hospital. We are governed by the physicians who are the majority owners. So the physicians have a lot of say-so in the day-to-day operations of the hospital, from the medical staff to the OR and to the equipment that they want to have as part of their hospital that they own. We have 3 existing hospitals that are open right now and 3 under development. They're all truly unique. Every hospital serves the physicians that are participating in the hospital. Every community has a different need, and so we will serve what Austin needs and what our surgeons need. Each hospital is like a 5-star hotel, so that when a patient and a family member walks into the hospital, you really don't think that you're in a hospital. It's not a cold, sterile environment. It's very warming. You feel comfortable there. The patients' rooms are very spacious. They're very beautiful. Some of the hospital rooms actually have a VIP suite attached to the patient room. That room has a flat screen TV, a refrigerator, a pull-out bed, so family can stay overnight. The caliber of physicians that we have at Forest Park, we think are some of the best that Austin has to offer to patients. The estimated number of physician partners we have right now, we have 70 in the partnership. We have 12 different specialties involved in our specialty mix. We hope to add additional partners in the near future, as well as additional specialties. We bring the best surgeons to our hospitals. We have the best staff, we have the best service. We feel like the best hospital that Austin will have. Forest Park Medical Center is truly one of a kind.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center. Brittany has a question for Dr. Tomas Antonini. What is the use of mesh for urology?
The most important answer to this question is it is patient-specific. For some patients, the benefits of using mesh will by far outweigh the risks. However, in some patients, they will be better to have the repairs done without any mesh. The important decision is to correctly choose which patients would benefit from mesh and which patients would not benefit from mesh.
case it's delayed or have issues at other facilities, I just look forward to the day that we'll be able to be here in a beautiful facility and make it run the way it should be run.
I'm really excited about this project. Looking around, I can tell that this is going to be a beautiful state-of-the-art facility, and I'm really excited with the concrete steps that we've made in the progress.
We're extremely proud of the project team out here to date. They're doing remarkable on the schedule. The design has been flawless. Right now we're on target to deliver the building in February, and all crews are working hard.
We hope that this will be a project that is very meaningful to the patients of Austin. Because there's no question that to the doctors this is a game changer.
I'm so proud to be here celebrating the topping out of Forest Park's 6th hospital. It will be an outstanding hospital from a service standpoint, and we will serve the community in a way that the community will be very happy with.
This is our 6th hospital we've done with Forest Park in the past 6 years. So it's been a great experience to have a partner working in an environment of trust and respect and really a true partnership.
They have a great safety record here that we're really proud of. And in fact, when I came walking up, I didn't have a hard hat on, and somebody said, "Hey, get a hard hat on." I can't tell you how exciting today is. Just getting closer and closer. I can't wait for this place to open.
For physicians, it's all about what you can touch and feel and do, especially for your patients, and to actually see the building coming up around us obviously is very exciting.
We've gone from a dream and goals to actually really seeing things starting to happen now. Can't wait to get in here and get started.
Forest Park Medical Center is your destination to better health. With that being said, let's hear what some patients have to say about their experience at Forest Park Medical Center.
I had 2 surgical procedures at Forest Park. I had bariatric surgery in September, and I've had my back surgery in April of this year. The staff at Forest Park was cordial, respectful. The checking in process was done efficiently. There were no surprises. They had called me the evening before to remind me of what I needed to do to prepare myself. I sat in the waiting room a minimal amount of time before I was called back to begin the pre-op procedure. In both cases, I was in on one day and I was out the very next day and felt very comfortable during the process.
Just walking in, it did seem like a 5-star hotel, but we were greeted at the desk by the concierge. They gave my husband a pager and explained to him what the paging system was like. They would send him a text how I was doing in surgery, where I was at, everywhere in the hospital. He was able to see at any screen where I was. And so it gave him a great sense of comfort knowing that, you know, he was being, even though it was electronic communication, that still somebody was letting him know as I moved through the progression of the surgery area, the recovery area, back to my room. He knew. It was incredible how the staff made sure that my family was taken care of while I was being taken care of.
I felt like I was in a 6-star hotel. The service was great. The people were wonderful. I really felt that I was treated as if they really cared about me and wanted to help me and get me to start recovering quickly.
And I felt really good being there. I didn't feel like I was in a sterile environment. It just felt homey. And that was nice because, you know, when you're not feeling good, it's good to be in a place that feels like home. And it was a place that felt like home. And my husband was able to stay overnight with me.
The nurses, the staff, everyone seemed really happy and ready to help you out. Where I've been to hospitals where it just wasn't like that. The rooms at Forest Park were extremely clean. The exterior, when you first see Forest Park, it does look like a 5-star hotel. Everything about it was a good experience.
Dr. Jeffrey Cohn is a plastic surgeon here in the Austin area who focuses on both pediatric and adult plastic surgery. Now let's meet the doctor.
I'm a plastic surgeon and have a unique background in also being craniofacial trained. So I have a very fun practice that combines both pediatric reconstruction and adult cosmetic surgery. Guiding principles are really trying to figure out exactly what the patient is looking for and what would best meet their needs. So I think it's, on one side, building up a relationship. I think that is really critical. And then the second is just delivering on that result that they're looking for. I think having a nice outcome, a natural outcome, I think that is really the priority.
As we see it, advances in medicine have as much to do with patient comfort as with medical technology. Oh, at Forest Park Medical Center, we invest in medical technology as much as any hospital in North Texas. It's just that we invest in other things as well. You see, Forest Park Medical Center was designed for warmth, designed for comfort, designed for, dare we say it, our patients. Come see for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
Hi, I'm Dr. Torrance Walker with Forest Park Medical Center, and I'm here today to talk to you about medial collateral ligament injuries, or MCL, sprains and strains. The MCL is commonly injured by a blow to the outer aspect of the knee, usually in a contact sport like football, or it can be caused from a twisting injury. However, most patients that have an MCL injury are able to walk on the knee after the injury occurs. However, they may limp. Usually it takes 2 to 3 weeks before the soreness and swelling to go down. There are several different types of MCL injuries, mostly graded 1, 2, and 3. The grade 1 injury is more of a sprain where the ligament is stretched. The grade 2 is a partial tear of the ligament, and grade 3 is a complete tear of the ligament. Grade 1, or it's just a sprain, most of these can be treated non-operatively, of course, with bracing and a little physical therapy. Time off from play may be necessary, usually in the order of 3 to 4 weeks. It's the same treatment for a grade 2 sprain, where it's partially torn. So most medial collateral ligament injuries can heal on their own. Grade 3 injuries, which are complete tears of the ligament, may require surgery if the knee is still somewhat unstable on clinical examination. Surgery in this setting is usually done because there's an associated injury, such as a combined ligament injury with the ACL and the MCL in the same knee. Ligamentous reconstruction of the MCL involves reinforcing the ligament with autograft or allograft. And this can be a source of tendinous or collagen material from your own body or from that of a donor or cadaver. After surgery, the patient is placed in a brace, and it may take, of course, 6 weeks before that ligament fully heals. During this time, the knee is protected with a brace and crutches, but physical therapy is started immediately to begin range of motion exercises to prevent stiffness. In general, if you feel as if you injured your knee or tweaked it and may have an MCL injury, then the initial treatment you should do is rest it, ice it, and elevate it. It's important that you get evaluated by a healthcare professional to assess the stability of your knee and make sure that the appropriate classification is determined for your type of ligamentous injury. Most people don't get a lot of the swelling with MCL injuries as they do with ACL injuries. And that's why I say some people can just go without getting evaluated, or they may feel as if they can go without it and get back into play. What can occur too is if you injured your MCL, that leaves your knee with a little bit of instability, and then you get back out and play and tweak your knee again, and then result in another injury like to the ACL or to the meniscus. So it's good to get checked out by an athletic trainer as soon as something happens, just to be certain that you have just a grade 1 or grade 2 sprain and not a more serious type knee injury.
Probiotics are basically certain strains of bacteria that are innate in our digestive system, and they're beneficial. We have kind of a symbiotic relationship with certain kinds of bacteria. So these probiotic things that you see in the stores or that you see commercials for are just strains of certain kinds of lactobacillus or other bacteria where they're trying to give you a mega dose to try to repopulate your digestive system with good strains. So the issue is that most of us are just fine. We don't really need to be supplementing all that. The time when it can be really beneficial is if you have a real bad gastroenteritis and some diarrhea from traveling and so forth. Probiotics actually have been shown to shorten the course of that. But overall, they're not something that needs to be used for a prophylactic reason or for any kind of dietary supplement reason.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor specialty. You can even do this by searching your current location to find the doctor closest to you. One of those doctors you can find on our website is breast reconstruction specialist Dr. Ned Snyder. Now let's listen as Dr. Snyder discusses the tug flap procedure.
A year ago, I was diagnosed with breast cancer. It was very shocking to find out that diagnosis.
Rita had breast cancer and elected to have a bilateral mastectomy, or have both breasts removed and have reconstruction of both breasts.
So I investigated flap grafts and came to find out that there are a lot of techniques that I had no idea existed.
On her abdomen, she didn't have a lot of abdominal tissue. She was a pretty thin lady and had more tissue to offer from her inner thighs. So there are two types of flaps that we can do from the inner thighs.
The one option that Dr. Snyder talked about that seemed the best for me would be to use a muscle from the inside of my thighs called the gracilis muscle, and that's the procedure that I wound up choosing.
In her case, we did what's called a TMG, which involves use of a very small piece of muscle from the inner thigh and blood supply that goes through it and the overlying skin and fat.
Dr. Snyder was very thorough in identifying risks and complications of the procedure, and fortunately, I didn't have any complications. For as long of a surgery as it was, and with as many people involved, and with the amount of work that had to be done, it was a remarkable post-op period for me.
Rita did fantastic in recovery. She had a 3.5 or 4 day hospital stay. Looks great. She wears a bikini bathing suit, and I think she says she feels very comfortable.
Dr. Snyder wanted to be sure that I was not just happy with the outcome, but very pleased with the outcome, and he would ask me that at my post-op visits. Today, I feel good about my body. And for someone who has gone through double mastectomies and reconstructive surgery, I think that's a profound statement to say. I cannot imagine what my life would be like without having this reconstructive surgery by Dr. Snyder.
The staff over at Forest Park Medical Center has an outstanding commitment to their communities as they support health-related causes. Forest Park Austin participated in this year's Austin Runners Club, the Debacker Challenge. The Debacker Challenge is a 5K and half marathon consisting of a hilly route throughout the countryside. The challenge is an event for all ages dedicated to promoting physical activity. So conquer the challenge. For more information on this event, visit austinrunners.org, or for more information on Forest Park Medical Center, visit bestdocsnetwork.com. Did you know eating oysters can keep your immune system strong? A 3-ounce serving has a quarter of your daily iron intake, plus twice the zinc you need in a day. Forest Park and their physicians are dedicated to helping change people's lives. Now we're going to take a look into part 2 of an incredible life-changing story that all started with a little girl named Hallie.
I've been working with Dr. Hobar since the early 90s. I was with an orthodontic team, and we prepared the babies for their first surgery, and Dr. Hobar was part of the plastic surgery team, and he actually did the surgery. My role in treating cleft lip and palate is that I see the babies under Dr. Hobar's direction, and I do the adjustments on the NAM appliance that they wear every day to start to form the nose and to bring the two segments together when they're a cleft in their palate, and basically get them ready for their first surgery, which happens when they're about 3 months old.
We chose to use the NAM appliance because we looked at a lot of before and after pictures, and with most of the before and after pictures that we saw, the ones that we thought had the best results were the ones that had used the NAM device.
We wanted to use it just so that we could say at the end of the day we did everything we could and expended every effort we could to give her the best result.
So what the NAM adjustment is when the baby comes in for their appointment, we take the appliance out and I take it into the lab and I'll add what's called soft acrylic to the tips of the nasal stents which form the nose, and I'll also add soft acrylic to a portion of the appliance where we're trying to close the gum segments and get them as close together as possible.
Hallie was 5 days old when she started her first treatment, and we had sent Dr. Hobar some pictures while we were in the hospital just to get he and Heather prepared for what she looked like and the type of NAM that they needed to prepare for her when we came in.
Heather, walks us through how to do that, make sure we know exactly what we're doing. We film it if we need to so that we can refer to it at home. We had seen YouTube videos where the NAM was strapped all around the baby's head, and it was just a long process of getting it on. And it still was a long process, but it's smaller, it's easier, and it seemed to be more efficient.
Dr. Hobar and Heather came up with a device that is just right around her mouth, and when you have a new baby, you're wanting to put her in headbands and hats and take her out, and there not be all kinds of things all over her head, and so I did like that as the mom.
When you use a NAM appliance, the results of the surgery, their first surgery at 3 months, is so much better than if you hadn't used it, because you're putting into place where things should be, because everything's there, all the anatomy's there, but it's not in the right position. So the NAM helps to put things in the right position so that when Dr. Hobar comes and does the surgery, what he basically does is knits everything together and puts it together correctly.
When we apply the NAM at home, we kind of work as a team together, and at first it started out with me putting in the retainer and him holding her down, and then as time went on we kind of reversed that. I just had that mommy instinct of I need to comfort her and hold her right after, and so he would end up putting the retainer in. It's just one of those things that you kind of dread doing every day on your baby, but it's so worth the results at the end.
The progress that we've seen with the NAM has just been incredible. When she was born, the premaxilla and her upper lip were all the way up in her nostril. Basically, it was like her mouth was shifted to the right because it was so sealed up. The NAM has come in and moved it all the way to the middle and moved it back, and it's been unbelievable to see, and you can just tell that her result's going to be so much better.
When I go back and think over the process that we've had with Hallie and that journey that we've had with Hallie from the first day she came in, now we're preparing her for surgery in just a few days, and even to think about it makes me want to tear up a little bit. It's one of the most beautiful things to watch, because it's not like we just watch Hallie, the baby. We see the growth in the mom and the dad and the things that we ask them to do, and nobody really understands that except for a mom and dad that have been asked to take care of their baby with a cleft at home. It's a really, really big commitment that they're making.
Working with Heather on the NAM has been incredible. She's an amazing person, and she loves Hallie like we do when we bring her in. She's just thrilled to see her.
She's not just a NAM specialist. She's here because this is her passion, and she loves the families that come in here, and we appreciate that so much. That just makes the whole process easier.
It's wonderful for Hallie because her progress has been exceptional. She's responded to this NAM appliance that we've created so beautifully. So we're excited to see what the surgery outcome is going to be. We know it's going to be phenomenal.
John has a question for Dr. Gutierrez. Can you feel the spinal cord stimulator?
We can set it to where you can feel it, and we can also set it to where you don't feel it. The sensation when you do feel it tends to be a very soothing buzz. It's described as kind of a light massage over the area that the patient is experiencing pain in, and thus it makes it feel a little bit better. Other patients don't like the buzz. It can be set to where it doesn't create that sensation. Regardless, there's evidence that the neurotransmitters that transmit pain are reduced in the spinal fluid, whether the patient's feeling that buzz or not. What you'll see is a reduction in pain.
Lodging provided by Radisson Hotel and Suites. And that'll wrap up this week's episode of Best Docs Network featuring Forest Park Medical Center, Austin. Now, if you're ready to request an appointment with any of the doctors you've seen on today's show, just head to our website.